Hi, Lena.
Hi, Eveline.
How are you going?
Good, thanks. How are you?
Yeah, very good. I'll just start with introducing myself, and then I'll let you introduce yourself. So
Okay.
I'm Eveline Geus, and I work at the Erasmus Medical Center as a postdoc. And I research biomarkers in skin wash, and we're trying to find biomarkers that can predict different skin conditions and that can feed in different parts of the Flexure project.
Wow, that's so cool. I am Lena. I am working at the TU Delft for, basically our aim is to develop biosensors that can be worn on skin. And I'm definitely looking forward to your results because we are exactly trying to target those biomarkers you identify to monitor a person's health status.
Ah, that's really interesting. And that's actually something that really excites me about this project. I've done multiple immunological projects before, but this is the first one where we work closely with different disciplines. So I'm an immunologist, and now we work together with the biotechnologists like yourself and also the people that know all about air pollution.
Exactly.
And they're trying to come up with a good method to study air pollution, measure air pollution, and measure responses to air pollution. And yeah, it's so new, and it requires you to speak a bit of a different language. And yeah,
exactly.
That's really exciting.
Yeah, it's really exciting. Yeah. This interdisciplinary project really aims to do something really impressive, I think. So, what's your day-to-day job then?
My job is lab-based. Mm-hmm. So I've only started working with the Flexure project in October, and in that time we started looking into a method to collect samples from skin. And there are different methods, such as creating a suction blister, which is pretty invasive, stripping off parts of the upper skin, mm-hmm. Inducing sweat. Or what we were most interested in, as it is very non-invasive, performing a skin wash. So we started with, cutting off a lab tube and using it to collect sweat, like closely taped with, layers and layers and layers, mm-hmm. of sticky tape. Mm-hmm. It worked, but it was very patient unfriendly. And we started adjusting the prototype slowly to something that we now believe will be very suitable to collect skin washes in patients. Mm. And on the way we managed to actually measure biomarkers in skin of healthy controls. So yeah, that's really exciting.
Yeah, really cool.
Yeah. And how about you?
I'm also mainly lab-based. So what we're trying at the moment is to find suitable materials and sensing technologies to be able to target a very low concentrations of biomarkers in the sweat of a person. So yeah, we envision to basically monitor the health status and also do it in a real time and continuous manner, so that we can see whether a person is, for example, affected by air pollution or by any external stressor, basically. So yeah, and we are trying I am trying at the moment to test just different materials, sensing technologies, trying out different modifications so that we can do it in a non-invasive and very, patient-friendly manner. Let's put it that way.
Yeah, I think that's really cool. And I think it will have really important implications for people with atopic dermatitis, for example, mm-hmm. because it's known that they respond to air pollution. And it will be really great if your sensors can pick up that response before they actually get
exactly.
Skin clinical symptoms.
Yeah, exactly. Yeah, I think that is also showing how many layers of impact this project can really have, right? So
yeah, absolutely.
So not only from my perspective, for example, research-wise, but also from your perspective of really helping or benefiting really individuals, and then also maybe clinicians and so on, right? So
absolutely. So what would you think would be an important outcome of the project? What could we deliver in the time that we still have left?
Yeah, so from my perspective, I think an important outcome would already be to really have a sensing technology that can be applied on a person, that can be worn by a person, and that can really give some insights on how certain external stressors are really affecting your health, basically by measuring biomarkers continuously. And what do you think is yours?
I would be really interested in, if we can actually distill some biomarkers from samples from patients and can use that to benefit treatment and to feed in your project.
That would be amazing.
That would be really great.
Yeah.
I really enjoyed learning more about your project, and I hope everyone enjoyed listening to us.
Yeah. Thank you.
Thanks.